Autism Spectrum Disorder by Small Group Discussion B5.
ASD is one of behavioral disorder which affect two-way direction of communication, language, and behavior. ASD can be diagnosed from childhood because symptoms generally appear in the first 2 years of life. The major characteristics of ASD are difficulty in communication and interaction, restricted interest and repetitive behavior, and difficulty in acting properly in the areas of life. According to World Health Organization, the prevalence of ASD is increasing globally. The objective of this paper are to have understanding about ASD, to know about epidemiology, etiology, pathogenesis, how to diagnose, the screening method, the differential diagnosis, clinical course and prognosis, and the treatment of autism spectrum disorder. The benefits are giving information and education, gaining more knowledge and awareness, and as the basic information about autism spectrum disorder.
Autism spectrum disorder is a neurodevelopmental disorder which usually characterized by the lack of social interaction, communication, and language. It usually occurred on the second year of life, but in severe cases, it may be noted even in the first year.
The prevalence of ASD varies in different countries and areas. To facilitate the data collection, US has ADDM, whereas in Asia there is none. The increasing number of ASD prevalence becoming nowadays trend, and ASD is 4 times more common in boys than in girls. Studies show increasing developmental disability percentage, including ASD. The increased prevalence is raising concerns about autism epidemic. However, strong evidence say it can be related to broadening ASD concept and change in diagnostic criteria. There is so few epidemiological study about ASD in Indonesia, so we have no data about the exact prevalence in Indonesia.
My name is Stephen Joviviono, number 161. The next is etiology and pathophysiology of autism spectrum disorder. The first is risk factor. The cause of ASD is multifactorial, such as gender. Boys are about 4 times more likely to develop ASD than girls. It because a gene called NLGN4. The next is medication during pregnancy. The prescription of valproate acid and thalidomide can increase the risk of ASD. The third is family history. Families who have one child with ASD have a risk have another child with ASD. The fourth is other disorder, such as Fragile X syndrome, tuberous sclerosis, and Rett syndrome can increase the risk of ASD. The last is parents age. Child from older parents have higher risk of ASD. There are also some controversies about ASD linked to childhood vaccine. In fact, there's no reliable study that shown vaccine have caused ASD. The next is biomarkers in autism spectrum disorder. Biomarker has not been a reliable marker in the past trial, but it can lead to a specific treatment by different patterns of abnormal genetics. Hence, more study about biomarker of ASD is currently needed. Some of biomarker that's known is genetic biomarker that related to genetic-based factor. Second is epigenetic biomarker that refers to a heritable change of genes activity that is not caused by change in DNA sequence. Third is body metabolism biomarker that related to physiological abnormalities.
Hello, my name is Greshan Rawan, number 40. So, autism spectrum disorder or ASD is always associated with general common medical condition, but neurological disorders are the most prominent. A study showed that overall patients with ASD showed a significantly more susceptibility to neurological disorder than the general population to have a range of neurological disorders such as epilepsy, macrocephaly, hydrocephalus, cerebral palsy, migraine or headache, and congenital disorder of the nervous system. In order to provide high-quality support to patients diagnosed with ASD, healthcare professionals must pay attention to neurological complications. This is because there can be drug-to-drug interaction and cognitive behavior such effects of medication in ASD patients with comorbid neurological disorder.
Diagnosis and clinical feature. Diagnosis is given by monitoring developmental history and behavior of patient. There is no reliable biomarker in diagnosing ASD. ASD can be diagnosed as early as 15 to 18 months of age. According to DSM-5, ASD causes significant impairment in daily life. Diagnosis criteria of ASD: first, deficit in social communication and interaction. Second, restricted repetitive pattern of behavior, interests, or activities. Symptoms of ASD must be present in early developmental period. According to PPDJJ 3rd edition, autism in children age should occur before age of 3. Three main areas of disorder including impairment social communication and restrictive repetitive movement. Children has deficit in language skill. limitation to play imaginative or imitation think, lack of emotion, deficit in reciprocal interaction, and lack of body language. Then there is unspecified autism. The individual has severe mental retardation with so low cognitive level, so don't meet the enough criteria to establish autism diagnosis.
There are three core symptoms of ASD. Number one, social interaction disorders, which can be in the form of hyperactivity or hyporeactivity. Number two, communication disorders include verbal and non-verbal communication disorders. And then number three is limited and repetitive patterns of behavior, such as ritual greetings and eat the same food every day, show special interest in non-functional aspects of an object, and dislike changes in their surroundings.
In general, ASD is associated with all kinds of behavioral disorder. For example, is attention deficit hyperactivity disorder or ADHD and alexithymia, although it has a different diagnosis. The form of interception make ADHD have a similar work mechanism and purpose as ASD. Then, alexithymia is a form deficit in emotional such as a social case caused by disturbances in sensory motor responses. However, this disorder is not much different with ASD and ADHD. It because every neurodevelopment system abnormalities will always be depend from excess inhibition responses in different brain neuron parts.
The incidence of autism spectrum disorder has extended throughout the globe, 1 in 59 children being identified with this syndrome. The symptoms usually emerge in infancy and toddler and cause individually, family, and network challenge. So the American Academy of Psychiatry recommends that every children must be screened at 9, 18, 24, and 30 months. There are several assessment tools for ASD screening. The first one is checklist for autism in toddlers to identify 18-month children. It uses parents' report and practitioner observation of early red flags. The next one is MCHAT. It's used to identify 16 until 30 month children. Each object in MCHAT requires a dictamous yes or no response. For the low risk, total rating is 0 until 2. Medium risk, total rating is 3 until 7. And the next step is MCHAT-RF. If the MCHAT-RF score is 2 or more, it's positive, but if the MCHAT-RF score is 0 until 1, it's negative. And for the high risk, total rating is 8 until 20.
Differential diagnosis that can be associated with autism spectrum disorder. There are several other disorders that have similar or identical symptoms with ASD. The first one is we have social pragmatic communication disorder, and then we have childhood onset schizophrenia. The third one we have intellectual disability, and then we also have language disorder, and then we also have congenital deafness or hearing impairment, and the last one we have psychosocial deprivation.
Here are the cause and prognosis of autism spectrum disorder. ASD is a neurodevelopmental disorder which begins in the lower level sensory-motor process and affects attentional, perceptual, motor, and social information integration. It also affects spaces of social interaction, communication, and behavior. The symptoms begin to show in ages as early as below 1 year old, as loss of skills, certain difficulties, and echolalia. Children between 1 and 3 years old experience behavioral changes, separation anxiety, phobia, and OCD.
With proper therapy, the symptoms will most likely to reduce during adolescence and adulthood. However, some other unspecified symptoms such as hypersensitivity may still be present. Without proper therapy or without any therapy at all, people with ASD will tend to show minimum progress or no progress at all. However, this can be treated by proper therapy such as cognitive behavioral therapy or applied behavioral analysis. Therefore, they can finally learn how to communicate well and finally function in the community. It was also stated that people with ASD tend to have lower life expectancy. But good surroundings and also proper therapy, as it was mentioned before, can help them to manage with life and therefore live longer.
for the treatment of autism spectrum disorder is the disorder can be cured. However, there are several therapeutic options that can be done to develop reduce symptoms, improve cognitive ability, and daily living skills. Through the therapies, hope the child can be independent, carrying out their daily activity. The treatment plans are usually multidisciplinary. For the older children and adults with ASD, not much is known about the best intervention. The type of treatment generally can be divided into following categories. Behavioral communication approach, dietary approach, medication, and complementary and alternative medicine. Applied behavior analysis has become widely accepted among the healthcare professional and used in many schools and treatment clinics. It will encourage positive behavior and discourage negative behavior to improve a variety of skills. For dietary approach, medication, complementary, and alternative medicine, please consult with the doctor for the further treatment plan.